I would like to introduce KIERSTYN CLAYCOMB, MBA, MPH. She's from the Penn Center for Global Health. She's going to be talking about orthoplastic and microsurgical capacity building for extremity reconstruction in Ukraine. Please.
Hello, everyone. My name is KIERSTYN CLAYCOMB. I work at the Penn Center for Global Health, where I manage our Ukraine program. I first of all would like to thank the organizers of the conference for bringing together so many incredible opportunities to provide updates on people's work in Ukraine. And thank you to the participants who are doing incredible work to support Ukraine. So I'm going to very briefly distill 3 years of very hard work by a lot of people and a lot of lessons learned into a very short talk about our program. When we began this journey, we had no real objective other than to support Ukrainian surgeons wherever possible. We began in April of 2022 in response to a request that came through one of Penn's patients at the Abramson Cancer Center. We launched a virtual consultation program with a single hospital, Pyrgov Regional Hospital in Vinnitsa. And each morning, teams of orthopedists, trauma surgeons, infectious disease experts, and plastic surgeons logged into Zoom at 6 a.m. To provide input and support for complex orthopedic trauma cases. Those consults, it was a single hospital, then it became 2 hospitals, then it became 3 hospitals, as you can imagine. But this process allowed us to, understand the injuries that were presenting at these hospitals and assess any gaps in training where Penn could provide additional support. And what we found was groups of incredibly talented orthopedic traumatologists. They were very skilled in treating bony defects. But what we also found was a high rate of unnecessary amputations. And this was really due to a lack of experience in soft tissue repair. So this is an area where Penn can provide a lot of expertise. We have a really strong group of surgeons at Penn, very well skilled and knowledgeable in reconstructive and plastic surgery. And so we thought, we could try to build a program around this and find a way to build sustainable capacity in Ukraine. So in December of 2022, we recruited 16 surgeons, brought them to Heidelberg, Germany, and launched our first flat course. Over time, we've just allowed this program to develop organically based on needs, keeping an open dialogue with our Ukrainian counterparts, but always trying to keep an eye on sustainability. But this is where our program is today. We think the model we've built is sustainable. Eventually, Penn won't be needed. We'll phase out of this, but we have a lot of work to do. Our goal is really to expand capacity in reconstructive surgery, but do it in a way that's sustainable, focused on quality and continual quality improvement. So this is what our program looks like today in a very simple visual. What we've built is a training pipeline. The intent of this training pipeline is to establish a sufficient foundation of expertise in Ukraine that can continue to carry this knowledge and these skills forward for generations to come. Our goal, is to train, we see a lot of surgical missions and we think that's great. And that provides a lot of great support at a time where there's a lot of acute need. But these patients will need surgical intervention for many years to come. And when the war is over, this expertise will still be needed for many years. So we start with our flat courses. So I mentioned them briefly. We launched one in Heidelberg. We've just recently done another in Graz, Austria, and have funding for many more of these flat courses in 2026. These flat courses allow us to reach as many surgeons as possible. It also allows us to assess skill levels. And for the participants, it allows them practice and hands-on training in basic soft tissue repair techniques for limb salvage and limb reconstruction. For those surgeons who are interested in more advanced training, we provide in-country training where Penn surgeons work side by side in the OR with Ukrainian colleagues. And the trainings are not only about developing skills, but it's also about working through surgical decision-making, differing approaches to different injury patterns, and building long-lasting relationships where surgeons feel supported to continue this work. And for those who show real dedication and real skill to continue this training, we offer a combination of the Penn flap course, which is an intensive 2-day flap course with an international faculty, international participants, and a really broad set of flaps, much broader than what we offer in the courses that we do outside of the US, but also provides more hands-on training. And then we pair this with an observership. The observership exposes these surgeons not only to orthoplastic and microsurgery in practice, but also provides them access to infection control experts, lets them see how residents and students are trained in US institutions. And we've seen a lot of really good initiatives come out of the observership, where we've had hospitals implement new infection control procedures that have helped reduce the number of hospital-acquired infections for the civilian population. And finally, we're super excited to announce that we've secured funding for an orthoplastic and microsurgery fellowship for Ukrainians at Penn. It's a fully paid 1-year fellowship. We have funding for 2 fellows per year over the next 5 years. And we feel like the combination of all of these initiatives will provide this foundation of expertise that will allow Ukrainians to continue training other younger surgeons in Ukraine. But all of this, there is a foundation of support, and support means a lot of different things, but primarily material support. So one of the things that positioned Penn very well to take this program on is we train our residents and fellows at Penn to do microsurgery without a microscope. So we train all of our surgeons with surgical loops. So material support means, providing them with surgical loops to be able to do this work in their own hospitals. Microsurgical equipment sets, not easily obtainable in country. And then the other side of support is providing a continuous open line of communication with Penn specialists when it's needed. And we do that through the virtual consultation program, as well as building, WhatsApp chats dedicated to different hospitals or different groups of surgeons. So a quick look at some of the numbers. So as of yesterday, we've done 520 virtual consults, and we've reviewed 835 cases. We've seen a lot of common injury patterns, and the virtual consults have been interesting because over time the dynamic has changed. Where in the beginning it was, how do we fix this? And now the surgeons present, this is what we plan to do, and get feedback on those plans. We've trained more than 60 surgeons across several parts of Ukraine. We've done 7 training missions in country, and we now have 8 surgeons performing free flaps independently in their hospitals. But when we first started this, looking at the training paradigm for microsurgery in the US, it's a lot of years and a lot of training. And, we had to ask ourselves a lot of hard questions. Is this possible? Can we do this and compress a training timeline down to a very short period of time? Would we have the support that we needed in hospitals in Ukraine to be able to do this? And I'm saying now that it is possible. So meet Dr. Roman Kuzmov. Dr. Roman Kuzmov is an orthopedic traumatologist who practices at Pirogov Regional Hospital in Vinnytsia. Roman, as an orthopedic traumatologist, was always interested in reconstructive surgery, particularly in restoring function and integrity to extremities, but found no formal pathway to train in Ukraine. But the war brought an unprecedented number of complex limb injuries. So Dr. Kuzmov attended our first flap course in Heidelberg in December of 2022. His precision and his focus and his eagerness to learn was immediately recognized by Penn faculty. And over the next 2 years, he continued training with the team both in Ukraine as well as in Philadelphia. We supported Roman with custom loops and a set of surgical instruments and the kind of essential consumables to make this work possible. And he did his first independent free flap in October of 2023. Since then, he's done over 1,000 pedicled flaps and more than 150 free flaps on his own. He embodies this concept of sustainability. So he has 2 young surgeons that he's now training in reconstructive surgery in his hospital. So just to switch gears from the patient perspective, why this work is so important. So this is Andriy. Before the war, Andriy worked in construction and was an avid wood carver. At 28, he was injured by a phosphorus bomb in Donetsk. That left him with extensive burns to his lower extremities and his face, and high energy blast injuries to both of his upper extremities. He was stabilized in Sloviansk and then transferred to Mechnikov. Then he was moved on to Pirogov in Vinica for definitive treatment. Upon arrival in Vinica, Dr. Roman Kuzmov evaluated him and found that he had severely limited function in both of his arms. He had an unstable non-union of his radius. Radial nerve was out. He had infected non-unions of several of his metacarpal joints and a large overlying soft tissue defect. His bilateral injuries made very basic day-to-day tasks incredibly challenging, some impossible. But Roman and his team, together with Penn teams, virtually mapped out a 3-stage treatment plan to restore the integrity and the function to both of his arms. Andriy received his first surgery in October of 2024. His team also were really diligent in connecting him to really high quality rehabilitation support, right from the start of his treatment. And you can see Andriy slowly getting more function and movement back in his hands, particularly his left thumb. This is Andriy today. Andriy's story really just highlights how this model can work. We are, providing patients meaning quality of life through multi-stage reconstructive surgery. Oh. So that, where do we go from here? So we feel that we're just getting started. We'll continue the program with the virtual consults and the flap courses and country training until we can get to a foundation of expertise where, Ukrainian surgeons can continue to carry this training forward in country. I think one of the things that we're really focused on in 2026 is developing a patient registry to systematically track outcomes. A focus on quality is something that's really important in the US, and it's a bit of a culture change for the teams that we've worked with in Ukraine. But I think providing some infrastructure and support to be able to do this will not only help, identify gaps in training moving forward, but it can also help identify policy that's needed. It also helps with funding. We want to develop a flap and frame course. So a lot of the things that we've learned over the past 3 years, there's a lot of desire for orthopedic traumatologists to use hardware in orthopedic injuries. We don't do that anymore. We encourage no use of hardware, but use external fixation. And we work with really talented surgeons in Ukraine that are at this point masters in external fixation used for lengthening bone defects. We'd like to put a course together that uses the flap and frame concept where, you're fixing the soft tissue defect and immediately putting on tailor spatial frames to be able to correct the bony defects as soon as they're completed with their soft tissue surgery. This allows, for immediate weight bearing, and they can begin some rehabilitation immediately. We'd like, I know there's been a lot of discussion about center of excellence model for things like rehabilitation. We feel really strongly about a center of excellence model for reconstructive surgery. This provides not only, an opportunity for patients to receive care, good quality care, but it also serves as an environment for people who are interested in continuing to do this kind of training, a place to do that where the expertise is sufficient to be able to learn those skills. And finally, we'd like to work with the ministry to develop a postgraduate fellowship program or, a new surgical specialty that would sit on top of, existing specialties to train and certify specialists in microsurgery and reconstruction. And we think that the certification is really critical because this not done well can really, increase the rate of complications and long-term disability. So just to say, every surgeon that we train represents thousands of patients whose lives can be impacted. And we think of this as not just rebuilding, but we're building a system for the future. And just want to say thank you. Direct Relief is a nonprofit organization who provides grant funding for us to be able to do this work. And I can't say enough about Yulia KOVACH, who I don't believe is on, but she has done an incredible job at helping us and helping to facilitate this work in country. But thank you for your time, and I'm happy to take any questions.
Thank you, Kirsten. I really like your statement. We're just getting started.
Yeah. We have
yeah.
a lot of work to do, but I can say that the surgical team at Penn that's been involved in this work is incredibly passionate about continuing to carry it forward and really dedicated and committed to seeing this through. So,
we
we've got
thank the
great
team
partners.
that allowed you guys to do it, and obviously we are saving lives and saving hands and whatever else is needed. Thank you.